Good evening, I'm Chris Matthews in Washington. Leading off tonight, summer in the city. Temperatures are rising in this country as town hall meetings on health care are turning into mob scenes. Noisy, angry, vengeful crowds are shouting down members of Congress who are trying to talk up President Obama's health care push. Catch this joyful scene surrounding Democrat Lloyd Doggett down in Texas when he called a town meeting. U.S. Congressman Lloyd Doggett of Texas, who was shouted down at his own town hall meeting in Austin, Texas. Austin is apparently, from what I've always been told, the most sophisticated political town in Texas, sir. Why the zaniness over the weekend at your town hall meeting? Let's, by the way, look at the pictures while you speak of what was going on there.
Well, Chris, what better slogan for the party of no, no way, never than just say no? One of the reasons is because many of these people were summoned in by the local Republican and Libertarian parties. They didn't even live in the neighborhood. They were there not just to be heard, but to ensure other people weren't heard on this. Real desperation tactic.
What are they up to? Why do they want to shut down any talk of reform in health care?
I think these folks are really desperate to stop health reform. They see that for the first time in 60 years, we really have, with President Obama and a Democratic Congress, a chance to enact meaningful reform and deal with these policies of health insurance giants that hurt small business, that deny choice to so many people, and deny them coverage at a time they need it the most. So just say no. A mob scene is just one way of trying to intimidate members into weakening their position. In my case, it really just reaffirmed my resolve to go back and get a strong public plan, force more competition, provide more choice to people, get the reform I know my constituents want.
Well, let's go through some of their attacks. One of them lately is this cultural front where they're saying that the new reform bill coming out of Energy and Commerce in the House would be a requirement that health practitioners come to older people and tell them, well, you better make plans now for living wills, etc. You're going to die someday and you're going to be in bad health, so you better make some decisions now. Is that the case?
Yes,
is that in the bill?
That was one of the cries of this Republican mob Saturday, that also was nice enough to have a beautiful marble picture, beautiful picture of a marble tombstone with my name on it. But they did express this concern about euthanasia. That's a real slur about this bill. I worked with my colleagues on that section of the bill. All that it does is to provide that a physician under Medicare can be paid for talking with a senior who wants to talk with the physician. If they want to express the desire to be tied to a machine indefinitely, or if, as in my case, they want to sign a living will to provide some instructions instead of letting someone else decide for them, they have that right. This has nothing to do with euthanasia, which is outlawed in this country, and we do not deal with euthanasia whatsoever in this bill.
Well, Mr. Doggett is one of the people writing the bill. Just to clear it up, as you just did, make it clear, no one will be approached to have to make end-of-life decisions. That would be entirely up to the patient, the citizen, to bring up the topic, right?
It's up to the patient to take it up with their doctor if they so choose to, and euthanasia is not one of the options.
Okay, let me ask you about your state. You also have a governor that was talking up secession lately. What's that about? I thought you guys joined the Union back in the 19th century, and we're quite happy here.
Yeah, Chris, that's like this crowd on Saturday, too, holding up the 10th Amendment and saying that the 10th Amendment prevents our getting a health care bill through. And when I asked them about that, because all your video shows is the end of the meeting, not the hour that I spent with them responding to their taunts and questions, they admitted that they're not only against health care reform, but they'd like to see the repeal of Medicare and Social Security. This is about whether our country goes backwards or provides the coverage people so much want.
Go forward with Austin, sir. Thank you. U.S. Congressman Lloyd Doggett of Texas. Thank you.